Hello everybody. Today I'm going to be going over how to teach a completely uninformed patient how to brush and floss. I'm going to be going over things such as the frequency, a little bit about the toothpaste, the bristles of the toothbrush. I'm going to be going over the different types of methods, or one of the most effective methods. And also for flossing, we're going to go over what's the point of it, how to do it, different methods on how to do it as well. And we're going to be going over like how people usually floss and how that's ineffective. So first let's start with the frequency. It's the soft spot, or like the sweet spot for frequency, is you want to do it 2 times a day for at least 2 minutes. Some people recommend 3 to 4 minutes. But people's lives are busy, so you want to do at least 2 minutes. As far as the toothbrush bristles, you want to buy a toothbrush that doesn't have a super hard bristle. Like you want a soft to medium bristle. And also the toothpaste that you're choosing, you're going to want to look up online when you have time, like the abrasion of it. You don't want it too abrasive to where you're doing this motion all day or twice a day. You're doing this motion and it's just going to be wearing down at your enamel over time. And as far as replacing these, it's recommended to replace them every 3 months. But if you start seeing these bristles starting to fray out like that without you doing this, you're going to want to replace it immediately, even if it's before 3 months. So about the toothbrush, how you want to hold it is, as you can see, it has somewhat of a curvature to it. So it's curved like that. So you're just going to want to put your thumb here and just hold it however it's comfortable for you. So just like that's fine. Some people with arthritis or other issues like that, they can't hold something this thin. They're going to need something bigger. So they're going to have to be holding something like this. They also have toothbrushes that have like a big tennis ball, so they're going to be holding it like that. So you gotta know your patient and their complications. As far as the method, we're gonna be going over the Bass method, which is the most effective method. So we'll go ahead and move the camera so we can see the type it out here. Okay, here we go. So what you're gonna wanna do is hold your toothbrush at a 45-degree angle. So right here, that's a 90-degree angle. That's how a lot of people usually brush, and that's not effective because you're just brushing the tooth surfaces above the gum line. You're gonna want to get deeper in there. You're gonna want to stimulate that gum tissue. So brushing like this isn't effective at a 90-degree angle. So again, just so y'all see a little better, that's about a 90-degree angle. What you're going to want to do, you're going to want to turn that just like that, more at a 45-degree angle. So that's the sweet spot right there. So we're going to turn it from a 90 to a 45. Go ahead and give you this view. So we're going to turn it from a 90 to a 45-degree angle. And we're going to want to do little tiny circles. And we're trying to imitate an electric toothbrush in a way. So you're going to do these little tiny circles. You're kind of jiggling the toothbrush, if you will. You want to do that on the surface that faces your lip. And you're also going to want to do that on the gum surface as well. So where your tongue is. So at a 45-degree angle, remember I'm not like that. That's 90. So at a 45-degree angle, we're going to do these little jiggles, little circular motions, right? And once you get to the anteriors, let's see. You can see a little bit right there. So once you get to the anteriors, most people put their toothbrush vertically like this, from the gum line all the way to the back of their teeth. So that's how you're going to want to brush your teeth, from the anteriors, which are your front teeth. Just like that. And then for your top arch right here, you're going to want to do the same thing. So you'll start at a 45-degree angle and do these little tiny circular motions. Might be a little too bright. There we go. So you'll do these little tiny circular motions. And one of the teeth fell out. Just ignore that. That won't happen to you if you brush. Just like that. Okay. So you get it. You get somewhat of a basic understanding on how to brush effectively, right? Okay, there we go. Now we're going to be going over flossing. So what's the point of flossing? Okay, a lot of patients will ask you that. They'll ask, what's the point of flossing if I've already brushed my teeth, right? So the point of flossing is to get deep down into the gingival pockets. So the gingival pockets are about right here. You want to get deep down in there because a lot of gunk can get trapped under there, and the brushing, just brushing itself, it's not going to get deep down there. So you're going to want to floss. So what you're going to do is take about maybe a foot to 2 feet of floss, right? And you're going to want to wrap it around your middle fingers, just like that. And you want to have these 2 pointer fingers as a guideline. So we'll go ahead and show y'all how the correct way to floss. It might be kind of hard to type it out, but the general idea is you're going to want to use a C and U method. So you're going to form a C around your tooth on both sides of it. And you're going to be going deep down into your gingival pocket, right into the interdental papilla, which is essentially this little triangle of gum. So you're going to go down on this side of it and that side of it. So again, wrap it around your middle fingers. And you hold this just like that. Your pointer fingers are a guideline. And you're going to want to go just like that, up and down on one surface of the tooth, right? On one surface, and then you're going to do it on the other surface. So if you can see, I'm kind of hugging the surface of the tooth. And you're just going up and down. You don't want to do a seesaw motion because that could cause some gum irritation. So you want to just go up and down, taking all that plaque from under your gum that your toothbrush can't reach. And you're going to want to do that for every tooth surface. So usually when people floss, they just do this. And that's very harmful to the interdental papilla, which we just went over, was that little triangle of gum. So what you're doing is you're basically just tearing your gums up doing that, and they'll get inflamed and they'll hurt. So if you haven't flossed for a while, you will see some gum inflammation, but that should go away after about a week or 2 of flossing. So once you're a little seasoned and you've practiced more, when it comes to flossing, it's not going to hurt as much. It'll be completely painless. So that's the general idea on how to floss and how to brush. So that's my demonstration on how to brush and floss. I hope y'all learned something that you can take with you into clinicals when you have to teach a patient one day. And thank you guys for your time.